Every protocol, every treatment, every exercise program, every supplement, all of it ultimately depends on one thing: delivery. Your body cannot repair what it cannot reach. It cannot nourish a cell that isn't being supplied. It cannot clear a tissue that has nowhere to drain. Everything in medicine, conventional or otherwise, operates downstream of a fluid delivery system that has been running continuously since the first weeks of your life. Dr. A.T. still understood this in the 19th century in a way that most practitioners still haven't fully caught up with. The artery reigns supreme. Not metaphorically, mechanically. Remove the arterial supply from any tissue and you have begun its death. Compromise it, partially, chronically, subtly, and you have begun its dysfunction. This episode is about the blood, what it carries, what gets in the way, and why the most important question, the one almost nobody asks before attempting to heal a tissue, is whether the drainage side is adequate, because you cannot pour fresh water into a full, dirty glass. Let's start with what blood actually is, because most people have never stopped to think about the full list. Arterial blood carries oxygen and glucose to every cell in your body, but that's the short version. Blood also delivers hormones from the endocrine glands to the target tissues that respond to them. It transports immune cells, your surveillance system, circulating continuously through every organ, joint, and soft tissue. It carries the growth factors and cytokines that initiate and regulate repair, the buffering agents that maintain the precise pH your enzymes require, the clotting factors that respond to injury, and it is the mechanism through which every therapeutic intervention you've ever had, every anti-inflammatory, every nutrient, every injected substance, every supplement, reached the tissue it was supposed to treat. There is no cellular event that doesn't depend on blood. There is no healing that doesn't require its arrival. This is what Dr. Still meant, not that arteries are anatomically interesting, that the presence or absence of unimpeded arterial supply is the first thing anyone serious about tissue health should assess. Every cell is a laboratory. The blood is the chemist who supplies it and who removes what the work produces. Now here is where the osteopathic model diverges from conventional medicine's default thinking. When most people hear compromised blood supply, they think atherosclerosis, plaque, narrowed coronaries, the dramatic events treated with stents, bypass surgery, or blood thinners. Those are real and important, but they represent only the most severe end of a spectrum that runs all the way down to restrictions most clinicians never look for. At the other end are the chronic, low-grade structural impairments to vascular flow that accumulate over years without a single warning symptom, until a tissue has been undersupplied long enough that something stops working. Fascia wraps every vessel from the aorta to the capillary bed. When fascia is restricted, through scar tissue, chronic compression, repetitive strain, it directly tethers and constricts the vessels running through it. A chronically tight scalene against the first rib compresses both the subclavian artery and brachial plexus simultaneously. Hours of forward head pressure reduces vertebral artery flow through the cervical spine. A restricted diaphragm doesn't just impair your breathing, it compromises the aortic hiatus through which the aorta passes into your abdomen. These aren't pathological blockages, they are structural compressions that reduce flow by degrees, silently, continuously, over time. You don't need a blocked coronary to have a vascular problem. The intervertebral disc makes the point clearly. After childhood, discs seem to have no direct blood supply. They depend entirely on diffusion, driven by movement and load cycling through your end plates. A person who sits for 8 hours a day in the same position has turned off the primary mechanism by which their lumbar discs receive nutrition and remove waste. The disc doesn't raise an alarm. It desiccates slowly and quietly over years. By the time imaging shows degeneration, the supply problem has been running for a long time. The tissue was trying to communicate something. The chemistry changed long before the structure failed. Here is where the model most people use for healing is fundamentally backwards. When a tissue is painful, inflamed, or not healing, the standard instinct is to add more supply, add more blood flow, more compression, more treatment directed at the area. When a tissue is genuinely ischemic, that means blood-starved, that instinct is correct. But most chronically dysfunctional tissues aren't blood-starved, they are congested. That distinction matters enormously. Venous blood carries metabolic waste, CO2, lactic acid, and other cellular byproducts away from the tissue and back to the heart and lungs for clearance. Lymph carries interstitial fluid, larger waste molecules, and immune debris through a parallel system that drains into the venous circulation at your thoracic duct. When either of these drainage systems is compromised, waste accumulates in the interstitial space. The local environment turns acidic, CO2 builds up. Inflammatory cytokines that should have been cleared remain in that tissue. In that environment, nociceptors, the pain-sensing neurons sitting throughout your tissues, become sensitized, not because new damage is occurring, but because the chemical environment they're sitting in has become hostile enough to trigger an alarm response. The tissue is not painful because something is acutely wrong. It's painful because the drain has been blocked long enough that the chemistry of that space has turned against it. Now, if you add arterial supply to that in a congested environment, that's more blood flow into a space that cannot drain. It means more pressure, more volume, more of the same chemistry, not a resolution. This is why osteopathic treatment addresses drainage before supply, through vascular point releases and diaphragm releases. The venous drainage pathway is opened before anything is done to increase that inflow, not because supply doesn't matter, it is supreme, but because the prerequisite for supply to actually work is that the drainage side is already free. That dirty glass must be emptied before it can be meaningfully refilled. Your cardiovascular system has a heart, a 4-chambered, electrically commanded, continuously contracting pump that moves roughly 5 liters of blood per minute through 60,000 miles of vessels. Your lymphatic system has nothing of that sort. Lymph is moved entirely by external forces. That's skeletal muscle contraction, thoracic pressure changes generated by breathing, and the smooth muscle in the walls of some of your lymphatic vessels. It flows in one direction, guided by one-way valves, collecting into progressively larger channels that converge at your thoracic duct. It's the body's primary lymphatic drain, which empties into the venous system at your left subclavian vein. Which means that every hour spent still, seated, supine, inactive, is an hour that the lymphatic system is running at a fraction of its capacity. The muscular pump is offline. The thoracic pressure changes that drive lymph through the duct are shallow and insufficient. Interstitial fluid accumulates. Metabolic waste sits in the tissue instead of clearing. Your lymphatic system has no heart. It runs on movement, and most modern lives have taken that movement away. This is why diaphragmatic breathing is a hydraulic intervention, not a relaxation technique. Deep belly breathing generates significant intrathoracic pressure changes that act as a mechanical pump, driving lymph through the thoracic duct with every cycle. This is why movement is non-negotiable in osteopathic philosophy. Not for fitness, not for muscle mass, but because without it, the drainage system that has no pump of its own stops running. Everything upstream of a stagnant lymphatic system stagnates with it. Here's the complete circuit in sequence. Arterial blood arrives at the tissue carrying oxygen, glucose, hormones, and immune cells, the chemistry of life and repair. That delivery depends on the structural freedom of every vessel from the aorta to the capillary. No fascial restriction, no postural compression, no vertebral narrowing of the pathways that the blood must pass through. In the tissue, the work is done. Oxygen is consumed, nutrients are metabolized, and waste is produced. On the other side, venous and lymphatic drainage carry those byproducts away. CO2, waste, inflammatory byproducts, interstitial excess. That outflow depends on movement, diaphragmatic pressure cycles, and the structural openness of the drainage pathways back to the thoracic duct and heart. Health lives in the exchange between these two sides, supply and drainage running freely through a structurally uncompromised system. Every osteopathic treatment that has ever reached beyond the immediate symptom has worked at some level on this circuit. Establish drainage before increasing inflow. Remove the structural obstruction to the supply. Keep the system moving so that the pump with no heart keeps running. The artery is supreme, but it can only be supreme in a tissue that is already draining. This series is building toward one question, applied to every system in the body. What is the structural prerequisite for this tissue to function, and is that prerequisite currently being met? In the last video, that prerequisite was structural freedom through the layers. Today, it was about unimpeded flow in both directions. Osteopathy. We are not looking for disease, we are looking for health.